Hello, I'm Dr. Beach, and today I want to talk a little bit about wrist problems. A lot of this is something that's very ubiquitous today because we're all using computers and typing and all of that. And so we get pain in the wrist, sometimes numbness and tingling going down the hands and the fingers. And often this is called carpal tunnel syndrome. And carpal tunnel syndrome, if it's severe enough, the surgeons will actually go and do surgery to decompress the nerve. Let me explain to you a little bit about what the mechanics are that's going on when we get this kind of problem. In the wrist, we have eight bones, eight little bones going across the wrist that are called the carpal bones. And they form, if you look at them from this angle, they actually form a tunnel, a little bridge like that, a tunnel, through which all the structures of the arm run through. So all the tendons that flex our fingers, the nerves that innervate this whole area, the blood vessels that do that, they're all going through this little tunnel. And this tunnel is called the tunnel of Guinan. Probably some guy named Guinan named it. That's usually the way it is in anatomy. So the tunnel of Guinan, all of these structures are going. Now, the wrist is a pretty small thing, and if you there's a ligamentous band that holds this called the retinaculum, which is very, very strong. That's compressing all this together. If you were to cut that band, the whole thing would just get really big. There's a lot of structures in there. It's very compressed, very tight. And that tunnel, at the top of the tunnel, there's one bone that's called the lunate bone because it looks like a little crescent moon. And that bone can collapse. In other words, it can drop from the superior part of the hand, which would be here, down to the inferior part of the hand, or from the dorsal to the plantar side, and it's dropping down. So it means that that tunnel collapses like this. And as it collapses, it puts pressure on those structures. If it's putting pressure on a nerve called the median nerve, then we'll start to get numbness, and we can even get atrophy of this thumb muscle here called the adductor pollicis muscle, and can create permanent damage to the hand. So what causes that kind of collapse of the tunnel is overextension of the hand. So extension of the hand means that the hand goes back. So what do we do that creates extension? Typing on a computer, using the mouse, all of that. We're going to do another video later on ergonomics and how to avoid that. But today I want to talk about the mechanics of it. So overextension or repetitive extension of the wrist forces that tunnel to drop down. So how do we treat this in chiropractic? What we do, because we do manipulation, is we push the tunnel back up. Basically, it's an adjustment where we push up this way and push that bone back up into place. So a few things: we open the tunnel up here, and then we push that bone back up there, the lunate bone, back up to the top to create the tunnel again. And it gives almost instantaneous types of results. People will come in with tingling. One of the tests that I do to see if they need it is I test the strength of the adductor pollicis muscle by having the patient put their thumb and little finger together, and then I pull them apart. And so if there's weakness there, I can just pull them apart like nothing. If they're good and strong, I can't pull it apart. It's very strong. Then I know that we're not affecting the median nerve. So if the person's having problems, almost always they're weak there. As soon as I adjust that bone and pull it off of the nerve, immediate strength comes back. But then there's some other things that can be done at home to help that, besides just me replacing manipulating the joint and bringing the bones back in place, which is an exercise. A lot of times I've noticed that the physical therapists teach people exercise using like a tennis ball and squeezing it. But the one I've learned and I like better is to actually take a rubber band, a small rubber band, put it around the fingertips, and then expand the hand like this against that rubber band. What that does is it strengthens the interosseous muscles, and it makes you hold the hand in its most natural position, which is this kind of position. This is the natural position of hand. This isn't so natural. This is natural. You go like that, it feels like you're stressing the hand. This is natural. And so when you do that exercise, it strengthens those muscles to give you that little bit of, I don't know if you can see it in the video, but to give you that arch in this area, which means that you're arching that tunnel of Guyana, as opposed to this, which flattens that arch. So that little exercise, I suggest you do maybe 20 or 30 of those a day. One thing I tell patients is just take a rubber band and keep it on your blinker switch in the car. And when you're sitting at a light or something, just knock a few off. Every day do that on both hands. Maybe not while you're driving. And that helps a lot to do that exercise. The other thing is if you're having a very chronic problem, and this is one of the recommendations I make for people who have severe problems, for a couple of weeks is that you wear what's called a cock-up splint. Excuse me. A cock-up splint is a wrist splint that goes from here to here, and it has a hole for the thumb. So you can actually wear it and still use your fingers. You can still type and do all of that. But it has a little plastic stay in it along the bottom that keeps you from extending the wrist, so it keeps the wrist straight. Wear this at night, because when we're sleeping at night, our hands often go like this, hanging off the bed or whatever like this. That creates a lot of problems. So wear it at night and then wear it during the day solid for about 2 weeks. That can be very helpful for these kinds of problems. That's another thing that we do. And then we often do electrical stim. I like to use certain Ayurvedic herbs. If there's a nerve problem, then I'll use sensitive plant on the area, which helps to revive the nervous system, and also Super Sport, which has an herb in it called Harsingar, which also helps the nervous system. Sometimes I'll use another herb called Mahakanchannar, which improves the blood flow to the area if there's a lot of tightness and congestion in the area. So there are different herbs that I use as well. But those physical things about adjusting, doing the exercise, wearing the band, those are all very, very good.